Stakeholders in the healthcare community provided their input last night on a measure that proposes a massive Guam Memorial Hospital bailout through refinancing of existing debt. Although informal, the hearing was held to clear up any misconceptions about how the proposals will affect Guam.
Bill 340, along with Bill 341 and another bill by Governor Eddie Cavill, have been mired in controversy. In particular, Bill 340 proposes to refinance existing debt in order to pay off $20 million in vendor payables at the Guam Memorial Hospital. The bill was referred to Senator Michael Nicholas's Committee on Taxation, but after refusing to schedule a public hearing on the bill and at the urging of other healthcare community leaders, Committee on Rules Chairman Senator Roy Respicio pulled the bill from Nicholas and sent it to Senator Dennis Rodriguez's Committee on Health. An informal hearing was held on the bill last night where several stakeholders and lawmakers discussed health care issues related to the measure. They mostly focused on the topic of Medicaid reimbursement rates, which appears to be in direct response to Nicholas's demand to increase the rate for GMH.
We keep on saying we have to increase the reimbursement of Medicaid and MRP. With Medicaid, we pay Guam Memorial Hospital per diem rate of $1,108. It used to be $332 when I started way back. And for outpatient, it used to be 32%. It's now at 97%.
Public Health Human Services Administrator Tess Archangel pointed out that Medicaid funding for Guam is provided through the Affordable Care Act, but only if Guam furnishes a local match. So, an increase in Medicaid reimbursement means GovGuam would need to increase its local match as well. There's also the problem of the Affordable Care Act itself. Public Health says the $153 million in ACA funding for Guam will expire in 2019.
We went from spending $928,000 in 2011 to $31 million in 2015, and we're 9 months into fiscal year 2016, and we've already drawn $27 million.
We don't have control over the payment of the OA.
Can you say that again? And so who pays Medicaid? It's not public health, because there was that out in the public that perhaps you are shortchanging GMH because you're paying private providers. But public health does not pay anything.
No, we just process claims.
And how do you process claims? Do you process claims? Do you put GMH claims aside and process the others first?
It's the same.
Meanwhile, the hospital management advisory team also told lawmakers that contrary to St. Nicholas's analysis of the bills, the life of a loan will not be extended even with proposed refinancing of bonds. So what exactly does that mean if GovGuam is able to refinance their debt at the terms they are hoping for?
It details what the savings would be in total, and it would be $15.7 million.
A public hearing has been scheduled for Bill 340 on July 18th at 4:30 p.m.